Good morning. Welcome to Health Report with Lenny Kinoti. Today we focus on a health condition called the asthma. It has impacted our communities within and beyond. Our very own Shalom Musau filed the following report.
In a world where clean air is becoming a privilege, a silent struggle continues among millions. Asthma, a chronic disease triggered by our environment, is on the rise. Right here at Masai Mara University, students and staff alike are not spared. What's fueling this respiratory challenge, and how can we breathe easier?
Good morning. My name is Sharon Sal. I'm Jen, a medical practitioner who I'll allow him to introduce himself.
Okay, my name is Hassan Mapesa. I'm a registered clinical officer. Welcome to this interview.
Thank you so much for joining us today. We're talking about asthma. What exactly is asthma and what is the trigger to asthma?
Okay, asthma, I'm going to it in a layman's way. Asthma is a chronic allergic condition. Mostly it's common during cold season. Cold season and maybe seasons where got a lot of dust, and since it's a chronic condition, majorly you find maybe the clients or the patient or a person usually become sensitive, having problems, having breathing problems during those times of the seasons, the cold seasons and the dust seasons. And usually patients present with wheezing. Wheezing, it's a sound like, do you know about the wheezing sound?
Yes.
That's wheezing sound. Usually brought by problems, the breathing problems. It usually affects the airways. The airways are the one that usually block, having problems passing the air, and sometimes also the blockage of the airways. So those are the main things that causes.
According to Hassan Mapesa, a registered clinical officer at the University Health Unit, asthma is particularly common during cold season and dusty weather.
So how can one differentiate between asthma and other respiratory diseases?
Okay, with asthma is difficult. No. The way it presents in the presentation, that one can speak a lot of history on it. First of all, the presentation, and in the history, when we're taking the history, we usually outrule, we rule out like the allergies.
Okay.
Mostly, someone will be having asthma in over life. It's kind of a lifetime condition. Maybe if we can differentiate it with something like TB, pneumonia, the presentation is slightly different. Pneumonia and TB is something like it comes in, I think, in the age. Maybe let's say when someone is growing, pneumonia, like it's an infection, bacterial infection. Different with asthma. Asthma is an allergic thing, which usually might affect someone from a young age, even to an older age.
Mapesa explained that asthma often begins at a young age and can be triggered by environmental factors such as dust, pollen, and cold air. He emphasized the importance of staying warm during cold season and minimizing exposure to dust to prevent attack.
Okay, so what are the recommendation practices that you could actually tell someone to avoid asthma, but also how to calm asthma if you're asthmatic?
Okay, in the management of asthma, we usually don't see really to avoid it because you can't avoid cold weather.
Sure.
And you can't avoid dust. You see, but at least during cold season, you need to keep yourself warm, something like that. During dusty times, I don't know if that is what you can do for that, but usually, if you feel problems breathing, it's better to be checked by a doctor so that we examine you, we see maybe the chest, how the chest is, whether it's blockage due to asthma.
He also encouraged early diagnosis and consistent access to medical care for effective asthma management.
Lastly, what advice would you give to parents or caregivers who are taking care of children who have asthma or caregivers?
It's good for if maybe I'm a caregiver with my child, it's good for me to usually make sure that the child has access to medical treatment, medical drugs, something like that, and also to be done routine checkups due to asthma.
According to the World Health Organization, over 260 million people worldwide suffer from asthma. As we continue to battle this chronic condition, awareness and early management remain key. Reporting for Vision Mind Media Network, I am Brian Lomuria.
Sometimes, asthma can go for a long time without even affecting someone, but it usually comes as an attack. And usually it's really dangerous and detrimental at that time when someone has an attack. Okay, maybe if you don't have access to a medical facility or these medical gadgets that we use during asthma, someone might even lose his or her life due to that. So it's good to be at least routinely checked and also to make sure all the time you have access to things that can improve asthma.
Thank you so much. I really appreciate it. Back to studio with Lenny Kinoti.
That comprehensive report on asthma was done by our very own Sharon Musau, voiced by Brian Lomuria. It is our duty to increase awareness and give more sensitivity about the health talk and everything we have to do to control asthma in our communities. Thank you. I'm your very own Lenny Kinoti. Follow us on Vision Mind Media social media platforms. Thank you.